Incompatibility. Blood incompatibility between mother and fetus, jaundice, and increasing bilirubin levels during the first 24 hours of life. So again, mo start o breakdown of RBCs ang maternal antibodies during sa afterbirth na kay di man siya makawa sa placenta, di man siya makaigo sa placenta ang antibodies. So nag-decrease pud siya og hematocrit ug hemoglobin, lethargy and irritability, poor feeding pattern, so vomiting, enlargement of liver and spleen. So yes, tani ma'am, unsa may mga signs sa kernicterus? We have absent ang Moro reflex. So unsa tong mga kinds nga absent ang Moro reflex? Ang kaning ABO incompatibility, apnea, sign of kernicterus ni siya apnea, high pitch cry o opisthotonos, which is arcing of the back, tremors, and seizures. So kung pangutanon ta kanus aman ka magkaroon ng opisthotonos, arching of the back, kung na sign ni siya for kernicterus, which is an assessment finding for ABO incompatibility. So kung na kernicterus ang patient, lethargy, unsa pa to? Irritability, and poor feeding, enlarge ang spleen and liver, blood incompatibility between mothers, jaundice, and anemia within the first 24 hours, ABO incompatibility. So say pathophysiology ana guys. Yun sa na siya pag-start. So the mother's body forms an antibody against the blood group antigen, and hemolysis, destruction of the RBCs begins. So nag-form ang mama og antibody against the ABO na type sa baby, yung may tawag ng ABO, mga antigens. So the process of antibody formation is maternal sensitization. Ang tawag sa pag-form sa mama og antibodies against the fetus is sensitization. So the bodies are of large class and do not cross the placenta. So di ba siya mag-cross sa placenta? Hemolysis of the blood begins at the birth during the mixing of maternal and fetal blood as the placenta is loosened. So as during birth mo, malusan ang placenta mo nang makasulod munang mag-mix ang maternal and fetal blood during that time. So first na form of antibody ang mama, muna siya gitawag na to na sensitization. The antibodies are of large class and do not cross the placenta. That is why during hemolysis only begins during the mixing of maternal and fetal blood as the placenta is loosened. Pathophysiology of ABO incompatibility. So the blank forms an antibody against the the mother forms an antibody against the fetal antigens, and the destruction of RBCs, sensitization, begins only after the process of antibody formation is called sensitization. The antibodies are of blank and blank. Hemolysis begins large class and do not cross the placenta. Hemolysis only begins at the birthing process during the mixing of blood between the maternal and fetal as the placenta is loosened. So signs of kernicterus katong absent ang Moro reflex, high pitch cry, opisthotonos, tremors and seizures. Tremors and seizures is also a sign of absent of kernicterus. Management for ABO incompatibility. So how do we manage ABO incompatibility, guys? Nga ba tayo serum nga ihatag sa baby or kailangan na to? Phototherapy. So, ano ba itong lain na kailangan na to phototherapy? To reduce mild to moderate kernicterus, exchange transfusion done on severely affected infants to decrease the antibody level and increase infants' RBC. So, kailangan na to, dari na ta, nag-ask ko ganina, ano sa itong need i-exchange transfusion? So, kung severely affected na ang baby, dari na kailangan og exchange transfusion. If dili madala jud sa phototherapy, 18 inches during hyperbilirubinemia. So, kana di ay. To reduce mild to moderate kernicterus, kailangan ta og phototherapy. Done on several affected infants to decrease the antibody level and exchange infant RBCs and hemoglobin. Severely affected infants man so exchange transfusion. How to care for neonate receiving phototherapy. So, kato, gibalik-balik na ni nato storya. Katong, i-take care ni mo iyang genital, iyang eyes. Protect the eyes from sunlight. Monitor, wala pa tanina ingon nga. I-monitor po dahil nato ang signs of dehydration. Nga naman. So, disorders of the retina resulting to impairment or vision loss. Disorders of the retina resulting to impairment or vision loss. Retina man daw. Disorders sa retina. Retinopathy of prematurity. Retinopathy lang. Etiology of retinopathy. So this is because of the nasobrahan kag oxygen, but how do you state that in words? Due to the excessive exposure to oxygen, high oxygen concentration, which the concentration hemorrhage within the retina area. The hemorrhage within the retina area. So retinopathy of prematurity, guys, na kay hemorrhage sa within the retinal area, hemorrhage no sa retinal area, and then retinal detachment, loss of vision. So magka-retinal detachment ka, dayon loss of vision. Etiology of retinopathy. So prolonged exposure to high oxygen levels, concentration, magkaroon ka ng hemorrhage within the retinal area. So this results into retinal detachment or loss of vision. So exposure to O2, hemorrhage within the retinal detachment, loss of vision. Interventions for retinopathy of prematurity. Of course, i-monitor na to ang oxygen. Kailangan na to siya ipa 50 to 70 mmHg. No? Administering the minimum amount of oxygen exposure, cautious administration. So interventions, cautious administer 50 to 70 amount born after a completion of 42 weeks of pregnancy, postpartum, post-mature infants. Etiology of post-mature infants, so it's because of the kuan siya kanang ang placenta is dili na kay siya maayo mag-do sa iyang thing, so progressively less efficient actions of the placenta. Assessment of post-mature infants. So how do we take care of post-mature infant? How do we diagnose nga o mo rin siya post-mature infant siya? Assessment, health assessment beta para ma-diagnose din nato siya. Post-mature infant siya if absence siya of vernix caseosa. So vernix caseosa is the katong cheesy, creamy, white type white sa sa baby. So as the baby decreases in age, magkadagan ng vernix caseosa o granugo katong iya hair. Minimal subcutaneous fats, rapod siya. Old man's face, leather-like skin, long fingernails, skin in yellow-green. So etiology of hypoglycemia. So unsa may cause hypoglycemia, guys? Hypertension, diabetes, inadequate glucose stores, and placental insufficiency. Assessment for hypoglycemic infants, the baby is lethargic na po. High-pitched cry, jittery movements, and at risk for siya sa convulsion. High-pitched cry, jittery movements, and at risk for siya for convulsion. So interventions for hypoglycemia infants. Interventions for hypoglycemic infants. Provide glucose infusion, so 10 to 25% IV glucose, no? 10 to 25% IV glucose. Monitor patient closely. Provide milk feedings. Decrease stimuli to prevent seizures. So, ipa-glucose, basta kaninang glucose infusion, hypothermia. Monitor ni mo siya. Sige, ayaw dyan kalimti nga. Kalimti basta hypoglycemia gani. Kailangan ni mo siya ipa-milk feedings. So, provide kag milk feedings and decrease stimuli to prevent seizures. Okay, diba? Assessment man mo kay jittery ang movement, convulsion, seizures. So, may difference sa convulsion ug sa seizures. Seizures, gunting. High-pitched cry po siya, jittery ang movements and convulsions. Hypoglycemia interventions, IV, katong 10 to 25%. Dayon, i-monitor po nimo siya closely. Provide kag milk feedings. Milk feedings, yung i-provide. Decrease stimuli to prevent seizures. Decrease ang stimuli, no? Para maiwasan na itong seizure. So, etiology of meconium aspiration syndrome. So, nakalanghap ang baby o meconium before or during birthing process. So, infant sick before delivery. Assessment for infants with mass. So, aspiration siya. Greenish or yellowish amniotic fluid. So, infant skin, umbilical cord, or nail beds may be stained by meconium. So, kung naay greenish o yellowish yung amniotic fluid, possible nga na siya meconium aspiration syndrome. So, apil po diyang mga accessory organs, mga umbilical cord, pwede po siya mabotngan o amniotic fluid. So, intervention for infants with amniotic fluid, meconium aspiration syndrome. So, may interventions niya. Adequate suctioning. So, yung suctioning kay enough na siya, no? So, interventions, so saan mo siya pag-heal? Adequate suctioning, oxygen administration. Adequate suction interventions for infants with MAS. Adequate suctioning, oxygen administration. Kapoy ko, guys. Left. So, etiology of small for gestational age. Again, wait sa. Some interventions for infants with MAS. Meconium aspiration. So, adequate suctioning. ba to guys? Adequate suctioning. So kailangan nimo suction jud tanan no, enough ng suctioning nimo pero kailangan i-jud lang nimo oxygen administration. Okay, so usually has a birth weight below 10 percentiles. They are smaller than 90th percentile. May appear physically and neurologically mature but is smaller than other babies. So small SGA babies. So etiology of small for gestational age, maternal causes, one is siyang hypertension, cardiac, pulmonary or renal disease, diabetes, poor nutrition, use of alcohol, tobacco, drugs, age, multiple gestation, placental insufficiency, pregnancy for high altitude. So kung also altitude na baby sa mountain siya nag-post, then it could lead to small for gestational age babies. Hypertension, cardiac, pulmonary or renal disease, cardiac, pulmonary, renal disease. Etiology of small for gestational age infants, fetal factors. Low birth weight, large genetic, normal genetically small infant, chromosomal abnormalities, so chromosomes, no? Ano pa? Malformations, congenital infections, rubella and cytomegalovirus. So ato na yung nagkako last time how napaka grabe tong rubella and cytomegalovirus kay cause jud siya og SGA. So itong mga fetal factors, chromosomal defects, congenital infections. So sabi na infection siya sa pagkuros niya cytomegalovirus and rubella. So naman tayo rubella vaccine, di ba? So clinical manifestations of small for gestational age infant. So how do we help those SGA babies? Also, may assessment niya, soft tissue wasting and dysmaturity, loose, dry, and scaling ang skin ba kay na makakaliskis, loose pa and dry pa siya and scaling pa siya. Perinatal asphyxia. So perinatal asphyxia is a term of kanang during pag-anak, perinatal kay kawalag oxygen ba na? Polycythemia, increase in hemoglobin count, respiratory distress and CNS abnormalities, persistent acrocyanosis, congenital anomalies. So kaning mga soft tissue wasting and dysmaturity, loose and dry and scaling skin, large na ni siya, di ba? Small gyapon. Polycythemia, ganong magka-polycythemia ang baby nga na ganong SGA people, magka-polycythemia siya. Ganong magka-perinatal asphyxia, so yung sa perinatal asphyxia. Comment down below. Laboratory findings, diagnostic findings for small for gestational age infants. Glucose testing will reveal blank, increase the potential for blank and blank. Blank level may be increased. Glucose testing will reveal. So kung mag-glucose testing ta, it would reveal decreased glycogen stores. Decrease man ang glycogen stores. No? Okay, kamay gani siya. Increase the potential for hypothermia and hypoglycemia. Hematocrit level may be increased while ang hemoglobin po niya is also increased. Wala yung polycythemia, di ba? Nursing management for small for gestational age infants. So how do we manage babies that are smaller than usual? Provide adequate fluid and electrolytes and nutrition. So pagkauno na to siya simple. Adequate fluids and electrolytes and nutrition. Decrease metabolic demands when possible. Atong iparas ng baby. Small frequent feedings. Gavage feedings. If no steady weight gain or gradual weight gain, ito ipag-gavage feeding. Prevent hypoglycemia. So i-monitor na to ang iyahang glucose levels and i-frequent na to siya feedings 2 to 3 hours. Maintain a neutral thermal environment. So ato naman yung na-discuss kanina, no? Basta SGA, maintain jud na to ang thermal environment. Nakas ganit down sa connection sa small for gestational age ug sa term temperature. So monitor serum, hematocrit, educate and emotional support. How to provide adequate fluid and electrolytes and nutrition. Okay, so saan man ato to provide adequate fluid and electrolytes and nutrition? Kaya kailangan man ka nato na siya buhaton. So gavage man ka, high calorie formula for feeding. So daghan og calories ang formula niya, no? Bisag gamay ra siya baghihatag kay daghan mo siya calories. How to decrease metabolic demands when possible. So kato gavage na to siya feeding, small frequent feedings, neutral thermal environment, decrease iatrogenic stimuli. So basin mo gawas ni ba kay iatrogenic stimuli kay kato ng mga BP, mga pang-check sa iyang temperature ganyan. So small for gestational age infants kailangan na to siya decrease ang metabolic demands. So para ma-decrease ang metabolic demands atong i-monitor siya frequently sa iyahang glucose and para ma-decrease ang metabolic demands magpa-gavage feeding ta, frequent ang feedings and i-maintain ang neutral na thermal environment as well as decrease iatrogenic stimulants. So how to prevent hypoglycemia? How do we prevent hypoglycemia, guys? We can prevent hypoglycemia by monitor na to ang glucose. So i-monitor dyan yung glucose, no? Provide early feedings, frequent feedings, IV glucose if glucose level does not normalize within oral feedings. If one who weighs more than 4,000 grams, large na siya. Predisposing factors for large hyperglycemia, genetic predisposition, excessive maternal weight gain, or controlled maternal diabetes. Pathophysiology for large for gestational age babies, overproduction of growth hormone in utero, kay nalagi siya ay uncontrolled na diabetes. So, tagas of insulin, insulin is a growth hormone man. Multiparous pregnancies, so daghan kag anak, multiparous. Manifestation of large for gestational age infants. How does this manifest? So, the mga birth injuries. So, we have listed 6 birth injuries such as fractured clavicle, facial nerve injury, Herb Duchenne palsy, brachial plexus paralysis, same na sila. Klumpke paralysis, phrenic nerve palsy, possible skull fracture. So 6 is fractured clavicle, facial nerve injury, Herb's Duchenne palsy, Klumpke paralysis, fractured clavicle, mana, phrenic nerve palsy, possible skull fracture. Manifestations. Management for LGA, so fractured clavicle. So, unsa man nimo pag-manage sa fractured clavicle? X-ray. First, kung i-determine mo if tinuod ba na siya fractured clavicle. Assess for crepitus, hematoma, or deformity over the clavicle. Decreased movement of arm on the affected side. Absent motor reflex. Limit motion, pain reliever. So, assess na to siya for crepitus, hematoma. I-limit na to ang motion. Hinahinay lang lihok ha. Pain reliever. So, fractured man iyang clavicle kasi hinahinay mo siya palihok. Management for facial nerve injury. Assess for asymmetry of mouth while crying. So, facial nerve injury, we always talk about sa iyang facial asymmetry. So, wrinkles are deeper on the unaffected side. The paralyzed side is smooth with swollen appearance. Swollen siya pero smooth the wrinkles kaysa unaffected side. If the eye is affected, protect with patches and artificial tears. Paralysis of the arm caused by injury to the upper. Muna siyang Herb's Duchenne palsy. How do we assess for Herb's Duchenne palsy? Assess for adduction of the affected arm with internal rotation. So, internal rotation na siya kung adduction. Dili siya mulapas jud, di siya ma-abduct ba? Ay, dili siya ma-abduct, ma-adduct ra siya. Motor reflex is absent, so absent motor reflex, sir. Daghan kay absent motor reflex no sa connectorus, sa kuan, diri sa Herb's Duchenne palsy, grasp reflex, however, is intact. So, naputo kanina, facial nerve injury. Kani siya, ang Klumpke paralysis kay iyahang grasp reflex is intact ra. Assessment, grasp is intact, absent motor reflex pod. Assess for absent grasp on the affected side. Hand appears as claw-shaped. Management for Herb's and Duchenne paralysis. So, gidungan na siya pag-manage, no? Nabadiri frequent exercise. X-ray, kailangan siya dato siya X-ray and upper arm. Delay passive movement of affected joints until nerve edema resolves. 7 to 10 days. Kung naman di siya nerve edema, no? So, i-delay na to na siya o movement. So, possible splinting to prevent wrist and digital contractures on the affected side. So, splinting. Management for large for gestational age, phrenic nerve palsy. Nerve that supplies the muscles of the diaphragm. Muna ginatawag na to phrenic nerve. Nerve that supplies the muscle of the diaphragm. So, mga muscle sa diaphragm, no? Muna siya ang phrenic nerve palsy. Nerve that supplies the muscle from the diaphragm is mo taas ang diaphragm. Respiratory distress ato ang gikuan ani kay unsa bay purpose sa diaphragm related ba siya sa respiration. X-ray usually shows elevated of the diaphragm, shows elevation of on the affected side. So avoid pneumonia during the recovery phase with the diminished rest sound. So skull fracture, soft tissue swelling over fracture sites. So nagaswelling ang assessment nato siya. Cephalhematoma management. So, muna niya itong giingon ni mga ingon siya muna. So, CNS signs and symptoms with intracranial hemorrhage, lethargy, seizures, apnea, ELSA, hypotonia. So, CNS signs and symptoms with intracranial hemorrhage, ELSA, lethargy, seizures, apnea, and hypotonia. Sa paano siya? Sa fractured sa skull fracture. Soft tissues swelling over fracture site, visible indentation in the scalp. So, na-indent ang scalp, no? Cephalhematoma positive ang skull x-rays. So we have right here inflammation of the middle ear, which is otitis media. So on etiology sa otitis media, greatest incidence is between blank and blank of age. This is related to blank, accompanied by a blank. Virus infect the eustachian tube that goes from the back of the nose to the middle ear, causing blank. So, greatest incidence is between 6 to 36 months of age. So, muna giingon ni ma'am na half a year old, and 36, how much is 12, 24, 36 to 3 years old. Related to eustachian tube dysfunction accompanied by blank, viral UTI. So, viral UTI dining otitis media. Viruses infect the eustachian tube that goes from the back of the nose to the middle ear. So, ang eustachian tube di ay kay sa back to the nose and sa middle ear causing swelling. So, mag-swell po no ang eustachian tube. So, pathophysiology of otitis media. What is the pathophysiology of otitis media? Swelling, fluid accumulation, bacterial growth, middle ear infection. Otitis media kay swelling, fluid accumulation, bacterial growth, middle ear infection. So, first is pathophysiology man. Kailangan ko makabalo sa pathophysiology. Pathophysio is very important na i-understand nato. So, swelling, fluid accumulation, bacterial growth. Kay kung fluid accumulate man jud kay mo jud na at risk po siya. At risk jud na siya for bacterial growth. Middle ear infection dayon. So, provides drainage and ventilation of the middle ear. So, ipa-drain siya and ipaginhawa of the middle ear mo ng tympanos. Tympanostomy o meryngotomy. So, kani meryngotomy, eustachian tube dili. May purpose sa eustachian tube kay drainage niya og i-ventilate. Assessment of otitis media. Otitis media is a how do we assess otitis media man? How do we assess otitis media? Oh, well, ato siyang i-assess if na siya red bulging non-mobile tympanic membrane. Na siya hearing difficulty, ear pain, difficulty sleeping, irritability, fever, loss of balance. So, connected pa rin siya sa balance, no? Ang otitis media. Kung mawala ang balance, it's very much likely nga na siya otitis media, no? So, nursing diagnosis for otitis media. Risk of falls, risk or injury. Kay, again, related siya sa balance. So ganito, loss of balance man siya. So, diagnosis niya sa otitis media is pain, hyperthermia, risk for injury. Pain, hyperthermia, risk for injury. So, na siya pain. Na siya pain. Na siya pain, hyperthermia, and risk for injury. Nursing diagnosis for otitis media. Pain, hyperthermia, risk for injury. Hyperthermia, kay fever, lagi daw ka, basta na otitis media. Risk for injury, kay loss of balance and pain because it is really painful to have this. So, tulo lang ito nursing diagnosis for it. Interventions for otitis media, meryngotomy, tympanostomy, and itong tympanostomy tube ba yun? Teach parents that as the child grows older, the position of the eustachian tube changes to facilitate drainage of the middle ear. So, ma'am, mo facilitate man ang eustachian tube, which is for drainage and ventilation of the middle ear. So, kailangan di mo siya i-avoid ang smoking around the child. Ano, gutpog ka mag-smoke around the child. Kakos ng bacteria sa mutana. Full course of antibiotic treatment. So, antibiotic treatment should go for eustachian tube, for otitis media. So, medical surgical management rin na itong may meryngotomy, tympanostomy tube. Complete course of antibiotic therapy for 10 to 14 days. So, kano sa man mo i-last ang imuhang, kano sa man ka mag-last sa imuhang kano sa man mag-last ang imuhang go over sa imuhang antibiotic therapy. So, of course, 10 to 14 days. So, drug of choice is amoxicillin, meryngotomy, tympanostomy tubes. Meryngotomy, tympanostomy tubes. Small opening in the child's eardrum is made, followed by insertion of tubes to facilitate fluid drainage, indicated for inflammation longer than 3 months. Small opening in the child's eardrum is made, followed by insertion of the tube to facilitate fluid drainage, indicated for inflammation longer than 3 months. So, for inflammation na mas longer na siya sa 3 months, muna tang meryngotomy ta. So, dili na ta mag-ditso ani, no? Medical surgical complete. Small opening in the child's eardrum is made, followed by insertion of the tube to facilitate, indicated when meryngotomy, otitis media. Small patel plastic tube placed into the opening of the ventilate the middle ear and maintain normal pressure. So, muna yung tympanostomy tube. Nursing management of child with tympanostomy tube. Give blank for discomfort following meryngotomy. So, atropine sulfate ba ni? Or basta pain relievers. Tubes normally stay in the acetaminophen atong pain reliever ani ha. So, gentle lang ta pag-teach. Mas makaremember ka kung gentle lang ka mag-teach sa ato. So, tubes normally stay in the blank for blank and comes out blank. Tubes normally stay in the tympanic membrane for how long? 6 to 12 months and comes out spontaneously. So, eardrum siya magstay. Sa acetaminophen ang ato ang i-provide. Give for discomfort following laryngotomy, and insert blank for bathing and swimming to avoid water in the canal. Insert earplugs for bathing and swimming to avoid water in the canal. So hearing is fully restored once the fluid is completely na out. Blank should be kept out of the ears while the tubes are in place. Water, fluid is removed. Inflammation of the conjunctiva, known as pink eye conjunctivitis. To the eyes is the clear membrane lining inside the eyelids and the sclera. It is normally pinkish, clear, smooth, and moist. So, muna itong lang taon mentino if color ba siya or red. So, this is the conjunctiva. Mo pa na ang conjunctiva, lower eyelid. Conjunctivitis. Are you sure? Not sure. So, causes of reddened and edematous conjunctiva. So, we talk about na ang conjunctiva kay reddened and inflamed. But what is the reason behind that? Infection? Trauma? Ano sa may reason? Bacteria, viruses, sakto ka trauma, bacteria, viruses, allergens, irritants. A conjunctivitis that is contagious and a conjunctivitis that is self-limiting, which means that it resolves on its own. So, conjunctivitis that is contagious is bacterial conjunctivitis. Viral conjunctivitis resolves on its own. So, mas makatapod yung bacteria, no? Basta conjunctivitis. Assessment of the conjunctiva. So, how do we assess the conjunctiva? Conjunctivitis. Reddened, of course, irritation. Reddened and edematous. So, wala po ka-here ani nga nagka-edema ang conjunctiva, but it is what is happening in conjunctivitis. Yellow, white, green, or purulent exudates. So, daghan og kanang pus bitaw. Irritation and watering of the eyes. Nursing diagnosis for conjunctivitis. So, how do we diagnose for conjunctivitis? For conjunctivitis, itong i-diagnose siya sa way sa say na at risk for pain. Knowledge deficit is safe administration of eye drops and ointment. So dili kabalo saon pagbuhatan ng mga tao, no? So nursing diagnosis na to siya kay painful din conjunctivitis and knowledge deficit kayo. Saon man nato pagbutang og safe administration of eye drops and ointments. So intervention of conjunctivitis, prevent the blank. Bacterial conjunctivitis usually resolves in blank after symptoms disappear. Interventions for conjunctivitis. So, wait lang.